Hello and welcome to the third episode of Know Your Doctor, the series from NephroPlus. I'm delighted that we have today with us Dr. Srinivasan Krishnan, who's a consultant nephrologist, one of the senior most nephrologists from Hyderabad. Dr. Krishnan practices at Apollo Hospitals in Hyderabad, and he also covers the East Marapalli Center of NephroPlus. He's been, in fact, one of our oldest supporters, our oldest partners. Such a pleasure to have you here, Dr. Krishnan. Thanks so much for making the time.
Thank you.
Just to go over a brief introduction of Dr. Krishnan, he's an MBBS and an MD and a DNB in nephrology. He took advanced training in dialysis at the Addenbrooke's Hospital, Cambridge in UK in 2002. He was the secretary of the Hyderabad Nephrology Forum from 1996 to 2021. He has over 8 publications in various journals. He is the co-author of the book Save Your Kidneys. His areas of interest include palliative nephrology, and he's been with us in NephroPlus for the last 15 years. So welcome, Dr. Krishnan, to this series. Thanks so much for making the time. We really appreciate you coming here and recording this episode with us.
My pleasure. My pleasure. It's always a pleasure to be with NephroPlus and a pleasure to interact with Kamal.
No, thank you so much, Doctor. So just starting off, Doctor, nephrology as a field, right?
Yes.
Just give us some history in terms of you were out from your MBBS. Had you already decided that you would look after kidneys, or was that something that came over much later?
Much later. So in fact, what happened was after completing my MD medicine, I was in medicine for about 6-7 years. I was very happy doing internal medicine and very comfortable with medicine. But I realized many of my juniors have gone ahead and specialized in various fields. But in retrospect, I feel even those 7 years, it helped me to mature, helped me to understand medicine much better and to apply it to the patients. And then I opted to do specialize in nephrology, which is generally an extension of internal medicine. And all said and done, kidney is an organ which is it's like a safety valve or pressure cooker. So all is systemic disease, whether diabetes or hypertension or any systemic disease is going to affect the kidney. And likewise, a disease of kidney is going to affect the entire system. It is one of the pivotal points in the human body, and extremely meticulous pathways inside the kidney to maintain your blood pH, to maintain the electrolytes in the body, acid base. Amazing physiology. So that I thought was the role of a kidney in the critical care patient, the critical patients, in sick patients, it is amazing. So I took this as an opportunity, did my specialized in nephrology a bit late in life, but nevertheless I enjoyed doing the course and I enjoy being a nephrologist. It's almost about 3 decades now I've been practicing nephrology. It's a wonderful field.
No, that's really nice to know. In fact, a small tidbit of information. Dr. Krishnan actually stabbed me in the back in the year 1997.
Yes, sir.
So when I was
Unfortunately, yes, sir.
When I was diagnosed with kidney failure, Dr. Krishnan actually performed a biopsy on me. So we go back a long way even before NephroPlus. So
despite that, we are good friends.
Yes, of course. Yes. So I think, Dr. Krishnan, now you've been practicing for almost 3 decades now. Run us through a typical day of yours these days.
Yeah, see, of course, now I have scaled down my activity. When those days, in my days of youth, I was a bit more busy. Anyway, now I enjoy when you walk into a dialysis unit or walk into critical care, you see the patient after a couple of dialysis, how the fluid status has changed, how his acid base has changed, how the medication dosage has been restructured, and what a tremendous change it has made in his vital parameters and basic quality of life. So that's what I keep telling not only the patient, even the attenders, that kidney, it is just the kidney, if it fails, it is just not kidney failure. It's the entire multi-system failure, because kidney has to take care of so many other systems and do a sort of fine-tuning of every system in the human body. So it gives tremendous pleasure once you see your treatment has clicked, your dialysis has improved the quality of life. You just walk across the dialysis unit, all patients are very sick. So you generally mitigate their problems. You make that their quality of life is much better, and then make them realize that dialysis is not at the end of the road. You can have a comfortable, normal life, do good dialysis and maintain your life comfortably, and we keep reassuring the patients, and it's rewarding. Not only the field of dialysis, field of transplantation, tremendous advancements, and now kidney failure is no more a stigma, no more a disease which you have to dread. There are a lot of things which can be done. Not only dialysis, in pre-dialysis stage, so many things can be done. And now, in fact, I have moved on to do this palliative care. I feel there's enough time for you to prevent the patients from going into the stage of dialysis. A lot of things can be done, a lot of medications, a lot of interventions can be done, and you try to push the dialysis as much as possible, because that gives the patient some time. You can correct a lot of his aberrations and make him fit for a dialysis or transplant. There are a lot of tremendous advances, and it's a wonderful field, very challenging.
It's wonderful, Dr. Krishnan. Thank you. And so once you're done with your work, right, let's say whenever, sometime in the afternoon, how does the rest of your day go? Is there something that you look forward to, some hobbies, some activity?
Oh, yes. That's a lot of things I did late in my life. I started learning music. I started learning keyboard.
Okay.
And I had some health issues in between, so I had to stay at home for an year or so. So that I utilized that time and I learned keyboard, and I'm an ardent music lover. So our family, we generally are deep into classical music, but I don't try. I have trained more in contemporary music. I love old Hindi film songs. So when I learned the keyboard, I told my keyboard teacher, boss, I just have to learn about 15-20 old songs. I'll use songs. Just teach me those songs. I'm not here to perform on the stage or do a jugalbandi. So I enjoy my keyboard. I enjoy visiting people, going for concerts. Me and my wife, both, we have that interest of listening to classical music, and a lot of spiritual inclines. So we go for various lectures and various satsang, and that gives me immense peace.
Wonderful, wonderful. Do you sing as well?
Well, I do sing, but there are not many audience for that. I appreciate my own voice.
Can I request you to sing a couple of lines of your favorite song for us?
So, yes. The other day,
couple of lines, if you're okay.
Sure.
Yeah.
सोचा है एक दिन मैं उनसे मिल के कह डालूं अपनी सब हाल दिल के और कर दूं तेरे हवाले फिर चाहे छोड़ दे या अपना बना ले मैं तो उसका रे हुआ दीवाना अब जैसा भी हो मेरा हो अनजान हो गुम है किसी के प्यार में दिल सुबह शाम पर तुम्हें लिख नहीं पाऊँ मैं उसका नाम आए राम.
Very nice, Doctor.
Dedicated to my wife.
Beautiful. Very nice. You sing so well. Such a nice voice, really.
Thanks.
Thank you so much. Yes. You, switching gears slightly, do you like to travel, Dr.
Oh, yes, plenty. So,
what's your favorite destination?
Yeah. Fortunately, of course, early part of our life was we used to enjoy visiting places abroad and in the country also. Now, of course, for the last few years, we do more. There's so much to see inside this country.
Right.
We have visited almost every state in this country, either in form to attend conferences or a family visit or as part of pilgrimage. I tell you, there is so much to see in this country, so much to enjoy in this country. Of late, I realized that our tier 2 cities, like for instance, we made a trip, our college alumni meet, we had it at Amritsar and we went to Wagah border.
Okay.
Then another group visit we did to Indore and Ujjain, that belt. One visit to Vijayanagaram, Hampi and this area.
Right.
Visakhapatnam, Araku Valley. Recently, about 2 months back, me and my wife, we went to Mysore. Wonderful cities, no pollution, no regulated traffic, no crowd, no dhaka mukki of all the metros. Yeah. So much of evening stroll, comfortably we could walk. The tier 2 cities are amazing because you have all the facilities,
right.
Less crowd, less pollution.
Yes.
So now we have decided this, going abroad, of course, once in a way, of course, if you visited some European cities or American cities, after point of day, if you all in the local lake. huge buildings, techno-advanced, broad building, less crowd, right? But the Indian thing, each state, each province, so it's wonderful, amazing to see the different cultures, people. The tier 2 cities, of course, now the tourism has developed so well in our country. It is wonderful to see all the places. Go abroad, fine, but plenty to see in this country.
Totally agree, Dr. Krishnan. I think that's very, very insightful. We now move to a section that we call the rapid fire.
Yeah. Mm-hmm.
So you have to answer immediately as soon as you ask a question. Yeah.
Or I can pass.
No passing here. No passing here. Okay, we'll get started. Your favorite sport?
Cricket.
Your favorite cricket player?
Well, it used to be Sachin Tendulkar. Now, after the IPL, it keeps changing every day. But now I feel Yashasvi Jaiswal.
Okay.
Yes.
And your favorite IPL team?
Because I am a Chennai, so CSK is all around. But now, this season, I feel KKR should get it.
Okay. Okay.
Yes. And Sunrise is Hyderabad. Hyderabad,
Very nice. And you're a movie buff?
Yes, I used to be. Now, of course, things have changed. College days, yes.
Okay. Which is the movie that comes to mind when I say which is the best movie you've seen?
I felt some of the Raj Kapoor films, Satyam Shyam Sundaram, for instance, those vulgarity and other things, but I felt the message conveyed and the way it was picturized, and likewise, Amir Khan's Tare Zameen Par.
Your favorite actor?
In olden days, it used to be Raj Kapoor. Then it shifted to Amitabh Bachchan. After Amitabh Bachchan, of course, now I'm out of. There are too many.
An actress you had a crush on when you were young?
Oh, Rekha. My wife was even after the wedding, she used to feel sort of jealous at times.
Wonderful. A book that comes to your mind which you really enjoyed?
Yes, recently, of course, it was your book.
Okay.
And there's another one gentleman by name Harimohan Paravu. He's a local person. He's a management trainee. He has been a Ranji Trophy player and has been with the Hyderabad Cricket Association also. He writes several books. He wrote a book called 15 Auto, Life Stories and 15 Auto, and this was released by VVS Lakshman.
Okay.
I went for the book release.
Nice.
I'll give you a copy of the book.
Sure. And your favorite specialty in medicine apart from nephrology?
I still feel palliative care. Which time now I realized there was a lot of advancement in. I feel God gives you enough time till he reaches the end point, end-stage renal disease or end-stage cardiac disease or liver cirrhosis or not. Before that, there is adequate time. Give good palliative care and then give him a lease of life at least a few more years. Right. Things change, science changes, medicines change, technology changes, surgical techniques change, and it also gives enough time for the person to accept reality, at least settle all his family issues, right. Save adequate money for the treatment. Palliative care is one field I feel all of us should practice it before you embark on latest, of course. Right. All said and done, latest dialysis machine, right? Yes. Nothing like God given. Even if a GFR of 10 mils per minute, that is different. Preserve that. Mm-hmm. So palliative care is, off late I have shifted most of my hours to palliative care.
Very nice.
Preventive nephrology.
Nice. It's such a pleasure doing this with you, but as a parting thoughts, some words of advice to the dialysis patients watching this.
In fact, I do conduct some patient awareness program periodically. I tell our dialysis patients this is not the end of the road. If only you take a little bit of interest in self-care, be it nutrition, be it adequate exercise, be it following the doctor's advice for adequate dialysis, a lot can be achieved. The life is near normal with dialysis also, with medications and with a little bit of self-care. Please take out time, do exercise, take care of good nutrition, take care of good social life, and last of all, a positive attitude that yes, this medicine will work for me and it works. So if you start questioning and then you start Googling and then WhatsApp and my neighbor and that doesn't work. have faith in your doctor, have faith in the system, have a positive attitude, things work. Things work really well, and you will find you are almost as normal as your neighbor.
Thank you so much, Dr. Krishnan. It was
My pleasure always.
talking to you today. Thank you so much.
So
thanks so much for watching this episode, friends. And please feel free to share your thoughts with us. Just shoot us an email and we'll be coming back to you month after month with new episodes of Know Your Doctor. Thank you. Take care.